and welcome. I'm Dr. Bryn and I'm sharing self-care tips so that you can optimize your health and be empowered. Today, I want to talk about something that's really exciting for women's health and cervical cancer prevention. So you might know of the familiar test called the Pap smear that women generally dread and don't enjoy doing. And a Pap smear is a test where we go into the doctor's office and a speculum is inserted to visualize our cervix, and then cells are taken from our cervix. And this is done to identify early changes that are precancerous, or sometimes they are cancerous, of the cells all around the cervix. And so this is what we call cervical cancer screening. Well, did you know that a virus is responsible for cervical cancer? This virus is called HPV, human papilloma virus, and it's actually the most commonly sexually transmitted infection. And most commonly, HPV can cause genital warts. Now, nobody likes to have genital warts, but they're not worrisome and they're not cancer causing. There are a few strains of this HPV virus that can be what we call oncogenic, and that means cancer-causing strains. For example, HPV strains 16 and 18 are oncogenic. So screening is changing, and that what we're going to be starting with are kits that you use in your home, and it's essentially like a long Q-tip that you will insert into your vagina and take cells of the cervix. Now, if those cells do not show any oncogenic or cancer-causing strains of the HPV virus, then that test is done and you don't need to repeat it for another 5 years. If there are cancer-causing strains that are found, then you would be required to do a Pap test. So this means that screening can be done from the comfort of your home. It doesn't have to be a very invasive exam. And a first step can be done to see whether you actually do require a more invasive Pap smear. So at the end of January, these test kits are available where I am in Western Canada, but check with your healthcare provider where they might be available. And I want to say thank you so much for watching. And if you're getting good value from the videos, please do subscribe below. And when I do research studies, I will always put the link in below.